World Breastfeeding Week. Just explain to us the importance of this and why is it such a big deal for a country like Namibia to mark this day?
Well,
Or week rather, sorry.
Yeah, sorry. Well, World Breastfeeding Week is actually celebrated the first week of August every year, the 1st to the 7th of August. So today is the last day. And it's something that's been endorsed by the WHO, by UNICEF, and many ministries of health around the world and societal partners. And this year's theme is basically closing the gap, breastfeeding support for all. And for us in Namibia, I think it's quite important for us to recognize and celebrate breastfeeding moms in all their diversity from all walks of life throughout their journey of breastfeeding. Because the support is something that sort of improves their journey as well, and it improves our breastfeeding, it improves their experience as breastfeeding mothers.
Absolutely. Talk to us about the benefits for both the mother and the baby.
Well, I'll start off with the baby. As a pediatrician, basically breastfeeding carries really huge nutritional benefits, number one. Also carries huge immunological development benefits with the transfer of important antibodies during the period, and also reduce risk of chronic diseases such as obesity and type 2 diabetes in children, and also just the emotional bonding between the baby and the mom. And also they've shown that there's been very good cognitive development for babies that are breastfed. And for mothers, number one, it's cheaper. It's cheaper for them to breastfeed. It's an emotion. It's a bonding time between the mom and the baby, and also it's very convenient. So that's some of the benefits for breastfeeding for the mom and the baby.
All right, brilliant. Perhaps just touch on the comparison between formula and the milk coming straight from the mother. Is there a huge difference?
Well, I mean, there's been a lot of development within the infant formula. Within the infant formulas that are available to us. But I think the major comparison that I always try and give is that whatever milk that you produce for your baby is perfect for your baby. It's got the exact nutritional content that your baby needs, and also as your baby grows older, this nutritional content and changes. So that's where I would always advise for breastfeeding to be the number one thing. But obviously we know that there are certain instances where breastfeeding is simply just not possible. We've got babies with specific medical conditions that really need very specifically curated type of infant formula for them. So we've obviously got to give a feeding opportunity to these babies instead of just pushing the breastfeeding agenda.
Absolutely.
Yeah.
And there are also myths and misconceptions that exist about breastfeeding.
Yeah.
And I've seen a couple of videos, especially from in Western countries, where women can't can't breastfeed in public, and they're frowned upon. It's like, oh, disgusting, how dare you do that? Talk to us about the situation here in Namibia and perhaps also on the continent, South Africa perhaps, do they share the same sentiments, or are we okay with it?
I think, number one, with breastfeeding in public, I think it's something that's been so incorrectly sexualized and inappropriately sexualized. And I think there's also a huge classism aspect to it. Because, I mean, if we travel to the more rural regions, or if we find ourselves in more poorer communities, it's not really something that is frowned upon. Women are breastfeeding wherever they are and wherever they feel comfortable. But the moment you walk into a restaurant or in a specific space with specific people, it's suddenly frowned upon. So I think there's really a huge classism aspect to it that needs to be discussed, because breastfeeding is something that's natural. The baby's got to be fed wherever I find myself, and I shouldn't have to wait to get home or into my car or have to find some sort of massive shawl to cover myself to do something that's normal, and I think that's something where society really needs to step up and really try to move away from. And I think other sort of myths and misconceptions is that breastfeeding is always painful, or it's always difficult, or it's normal for you to have infections and all of that. And I think, when the moment you have difficulty breastfeeding, or mothers are experiencing things like sore nipples, or experiencing a problem with their supply, they should seek help, and healthcare workers should be ready and available to help them and educate them with these problems.
Now, obviously, there are various challenges for mothers, let's say, who live in more rural areas and those in urban areas in accessing, medical assistance. But what are some of the other challenges do mothers face, breastfeeding mothers face, apart from the fact that, they have very little access or no access at all in some instances to medical assistance when they encounter the problems that you have mentioned?
I think one of the major challenges that they do encounter is that they now have to make a choice of, do I continue breastfeeding or should I now, start formula milk? And one of the biggest things, especially in our setting within the poorer communities, is the affordability of infant formula milk. And these are then the things that drive problems such as malnutrition because, the WHO recommends breastfeeding exclusively for the first 6 months and before we start sort of supplementary feeding. And if we stop breastfeeding too early and we're unable to afford formula milk, that's where then we drive up the rates of things like malnutrition. So those are some of the challenges definitely that are experienced.
Would perhaps a possible solution be government subsidizing baby formula as as an essential need for breastfeeding mothers?
Well, I mean, that's a whole other contentious topic because obviously then we need to look at budgets and all of that because infant formula is not cheap. But that's why, the government's message and mandate has been to encourage breastfeeding exclusively for the first 6 months. And I think that message then needs to be pushed through from healthcare workers and into society as far as possible because one of the things that happens is that because of misinformation and miseducation, mothers then will experience things like, oh, my milk supply is too low, so let me start to supplement with other things. But I tell you that, as a woman, you will produce the amount of milk that is appropriate for your baby. So as long as your baby's gaining weight during that period, as long as, when you do your clinic visits and your immunization visits, your baby's meeting all their milestones, that is, you are producing enough milk for your baby. But I mean, we do have situations whereby, other family members come in and like, oh, you've got very small breasts. There's no way you are producing enough milk for your baby. And that's where then the misinformation comes in. So I think if we can really drive that breastfeeding education, we're not going to need to move towards the government having to supply formula milk, because formula milk also then, especially in poorer communities, comes with things like, is there electricity to boil this water? Is there ways to wash these bottles and sterilize them safely? Because if we don't do that, then we're going to drive up other problems such as diarrhea. So there's sort of, pros and cons to all of this that we have to really investigate.
But there are women who have complications in terms of producing enough milk. What are the contributing factors? And how can it be remedied? Is it a change of diet? Is it caused by stress? Or what are the underlying factors there?
So definitely that is a struggle, with low milk supplies. And one of the things is really things like stress, lack of sleep, poor nutrition, poor hydration. Just, the stress of having a newborn in your home with no proper support. Because remember also, with all of the urbanization that's taking place in our society, the definition of family and support has truly changed. People are moving more towards this nuclear family of just mom, dad, and baby, and no longer having aunties around in a support system. And that definitely contributes to the early experience of a woman with a newborn. And, ways we can remedy it is just improving the support within the home, making sure that, mom is really only worrying about the baby and not everything else in the house. If you're a friend visiting a new mom, go there with some food and, don't just go there to, sit and have conversations, but then offer help. What can I do? Wash dishes in the kitchen, help hold the baby while you go shower, because those are the small things you can do to improve their experience, allow them to relax and just sort of for the natural process of milk production to take place.
And I think that's the misunderstood, the unheard story, unspoken struggle of the breastfeeding mother, because obviously my next question now, as a father, you're somehow also dumbfounded as a first-time father trying to figure out what do I do, because the mother is going through a whole lot of emotions. She's stressed, her body has undergone change. Where do I help now as the father to lighten, or at least, lighten the burden of what she's going through?
I think the first thing you've got to do when you find out that you're going to be a father is start educating yourself on how you can support this mom even before the baby comes. And that's where the support needs to start. And that's where already you can sort of reduce the stress and anxiety, is for you to just be present. And once the baby comes, is for you to really be hands-on and not to just, make this the mom's job. So the mom, yeah, she needs to breastfeed, but then you be present for the diaper changes, for the bath times, for the cuddling and the holding the baby when the baby's crying, and not just, oh, he wants the mommy. And other ways is for you to then be actively involved in things like cooking. And even if you can't cook, then, come up with an alternative where we're going to find the food, so that she doesn't have to worry about, okay, what are we having for lunch? What are we having for supper, for example? Helping out by also just educating yourself on breastfeeding so that if she's struggling, you can offer solutions. Okay, maybe we can, call this nurse or call this midwife, or, because if you've equipped yourself with some solutions and maybe she can't think of them because this is really stressful situation, that's where you will come in. And I tell you, it will really relieve a lot of the stress and also just improve your relationship and improve your experience as first-time parents.
Yeah, because everybody who's watching this is a bit more traditional, because growing up in a traditional African home, it's always a thing of like, that's a woman's job. The man is not supposed to do that.
Yeah.
But I guess with younger and more modern parents, the times are changing, and I think it makes a lot of sense. Let's talk about the healthcare professionals and communities in terms of their support towards breastfeeding mothers. What is being done, and what do you think can be improved on?
Oh, yeah. I think healthcare workers are trying. They're doing their part in terms of breastfeeding education and supporting the mom while they're still in hospital or within the clinic spaces. But I think what really needs to be done is to extend that now into the home and community area. So things like community-based carers. We have what we call lactation specialists, many of them nurses with this experience. And a lot of the times it's more people who can afford it, who can then call in these lactation specialists into their homes and sort of assist them within the home with things like breastfeeding and how to improve your experience for breastfeeding. But I think this is something that should be offered to all mothers from all walks of life by capacitating community-based carers and seeing how can they then support these new mothers within their home instead of having to always go to the hospital or the clinic to seek this help. Because I think then we can also definitely improve breastfeeding in general. And then as a community, I think I'd like to speak specifically to workspaces. Even just here where we are. Remembering that, even we're always pushing this message of exclusive breastfeeding for 6 months. But then we forget that mothers have to get back to work at 3 months. Maternity leave ends. And then she's got to stress about, am I going to pump enough milk? Where am I going to pump? Am I going to have enough time to eat lunch, drink enough water to produce enough milk? And I think what workplaces need to really, really standardize and include within their wellness packages and wellness programs is how can they support breastfeeding mothers? Create a safe, clean, quiet and relaxing space where mothers can, intermittently go and pump milk, have a fridge there where they can store their milk and then take it home for storage in order to allow their babies to have breast milk when they are away from work. I think those are small things that workplaces can do to support these mothers, because there's this message that's always put out there, we need to breastfeed, but we need to also get back to work and find a balance. So I think, workspaces, corporate spaces, they need to create these safe environments and really remember their breastfeeding mothers.
Absolutely, not let mothers feel like they're an inconvenience to the organization.
Absolutely, because this is a normal part of life.
Absolutely.
You've given me the maternity leave, but then also allow me to continue to be a mother once I've returned back to work.
All right. Any parting words on the last day of breastfeeding week? I think this is something that needs to be paid attention to all year round.
Yes.
It's not only on this week, of course, but what are your parting words?
I think really, thank you so much for having me, and thank you for this conversation. And I think really with this year's theme of closing the gap, we really want to emphasize that, breastfeeding is something that we're always encouraging. But we then as a community and as a society, we need to really every single day think about how can we make it easier for these mothers that are breastfeeding? How can we make it easier for them to be able to carry out this very sort of special, natural process without it having to be a burden on them.
Absolutely.
And that's something we really need to recognize and have those conversations in our workspaces openly. You know, when somebody returns from maternity leave, recognize and see, you know, how can I support this person? Because they've already got the stress of leaving their baby at home now, you know, so how can I make them better? Because I tell you, having that support for them is actually going to even just improve their output within the workspace.
Absolutely.
Yeah.